Welcome back. This is Lunchtime News. Now, we move to the interactive segment of our Lunchtime News, where antimicrobial resistance is emerging as one of the biggest threats to global health, making once treatable infections harder and sometimes impossible to cure. We're joined this afternoon by Dr. Joseph Mbuthia, who's the chairperson of the Gertrude Children's Hospital Antimicrobial Stewardship Committee, to discuss a growing threat of drug-resistant infections and what can be done to combat them. Welcome.
Thank you very much.
All right, now to start us off, perhaps how serious is antimicrobial resistance in Kenya today?
Quite serious, I would say. If you look, it does cause over 1,000 deaths a year directly and probably 5,000 indirectly. And those who are in the field from time to time, we get very difficult to treat patients who, because of the difficulty in treating their resistant infections, they spend long times in hospital. So I would say it is a serious problem and one that is rising. It's increasing.
So many people have heard of antimicrobial resistance, but many do not fully understand it, perhaps. What is antimicrobial resistance and why should we all be concerned?
Now, first of all, we would say antimicrobials are drugs that we use to kill germs. And germs could be of various types. There are bacteria, which are the most commonly treated with drugs, which are called antibiotics. And then there are viruses, which are treated with antivirus. The most famous example would be like HIV, which we use antiretrovirus to treat. We have parasites like malaria, which we use antimalarials. And then we have fungi, that's for fungal infections. And in each of these classes of antimicrobials, there is resistance. Resistance is where a drug that was used to kill a germ can no longer be used to do so. Good examples in all those areas. For instance, malaria. In the past, it used to be treatable with chloroquine, then with drugs that we used to call SPs like Fancida. And with time, we find these drugs are not working. This is where resistance comes, where the malaria parasites learns not to, to live with the drug, and then it can no longer be killed by that drug. That is called resistance. Same thing with antibiotics. You may treat tonsils with a simple antibiotic this time, but if there is resistance, the next time you want to treat the same infection of tonsils, you have to use something much stronger because of resistance. You might wonder, why does resistance come? If I give an example of antibiotics, it comes when we expose organisms to too many antibiotics, when we overuse them, and especially when they are not needed. And when we use the wrong ones to treat certain diseases, when we do not use them using the correct dose, therefore we expose the germs to the medicines, but do not completely kill it. So what remains multiplies and becomes resistance. So that's one way. So, for instance, for antibiotics, too many of us are using antibiotics for very small reasons. Get a sore throat, the next thing you're at a pharmacy looking for an antibiotic. Your child gets a fever, the next thing you do is run to the pharmacy, get an antibiotic as well as paracetamol, and you think you're doing the right thing. You're just creating problems of a rising antibiotic resistance.
Why is the resistance often described as a silent pandemic?
A silent pandemic because One, we are not doing a good job at tracking it, therefore it's creeping up on us. Number two, it's going to be worse with time if you don't do something about it. So if you're not alert and stop it on its tracks or contain it at this time, in a few years' time, it will be a major thing. Already, we think it causes more deaths than malaria or even HIV. So it is an unrecognized silent pandemic. Yes.
Perhaps what are the biggest drivers of resistance in Kenya?
Again, if I use antibiotics for a good example, one, it's overuse. And that is too many people using antibiotics, mostly for the wrong reasons. The other one is not using the right doses, not using medicines for the right duration, like you might stop before you're completely cured, and therefore the disease comes back with even stronger resistant germs. Using substandard medicines, and we all know there are all manners of medicines out there. If it depends on the pocket, the amount of money you want to pay. So some medicines may not be of the right quality to deliver the killing power. So again, the quality of medicine is a driver of resistance. So overuse, incorrect use, and sometimes also poor quality medicines.
Mm-hmm. So you mentioned earlier that parents perhaps rush to the nearest pharmacy and give antibiotics to their children. Perhaps what should they know, what should parents know when giving these drugs to their kids?
One thing is like you're driving blind, because your child has a fever and you do not know what's causing that fever. It's best to go to a professional to look at the child and make a diagnosis and find out what is ailing the child, and then it can be treated properly. A healthcare professional trained to make a diagnosis will be able to say, okay, your child's hot and they have a fever because, for instance, they have a urinary tract infection, or they have an infection in their ear, one of the common things. And then they will say they will probably know what is best to treat that child, put the child on the appropriate medicine and the appropriate dose.
Mm-hmm.
Yes.
Perhaps beyond human health, how do livestock farming and agriculture contribute to microbial resistance?
You see, germs are in the community. And let's say, for instance, if I get a diarrhea disease, it's probably something I picked in the environment. Now, if the animal health sector is overusing antibiotics and also misusing them, it's exposing the germs in the environment to substandard, or rather to antibiotics that are also used in adults, or rather in human health. So if you pick that bag from the community and it's already been exposed to antibiotics, it's likely to be resistant. I think we've seen a few examples of, say, things like, for instance, typhoid, which is from, if for lack of better word, eating dirt or things that are contaminated. This, let's say, for instance, typhoid germs may be out there in the environment and may have been exposed to antibiotics that were perhaps used to feed animals, feed the chickens, and then you pick the typhoid germs from, say, the chicken, and it will probably be very resistant because the chicken may have been exposed to the same antibiotics that the doctor might want to use to treat your typhoid. So we have to work in concert with the animal health sector as well.
Now, as we come to a close, Gertrude's Children's Hospital recently became the first hospital in Kenya to receive the Global Antimicrobial Stewardship Accreditation. What does this recognition mean?
It's a major recognition that Gertrude's standards for using antimicrobials matches best standards or best practices in the world. The accreditation system is a global one, and it uses certain measures. It's a process that took us a whole 3 years, and it involved improving our practices, right from prescribing, from dispensing, including also laboratory practices, how we diagnose diseases, and how we do tests to identify what best medicines to use. So it's a rigorous process, and it made us a better hospital. So by the time we are being accredited, we can measure up in the way we use antibiotics or antimicrobials with the best in the world. So it's a rigorous one, it's very thorough, and we are proud to have been accredited.
All right.
Yes.
Congratulations on that.
Thank you.
Well, that was Dr. Joseph Mbuthia, who is the chairperson of the Gertrude's Children's Hospital Antimicrobial Stewardship Committee. Well, thank you, sir. All right. Now